Today we are going to talk about the 3 things you should know about HIV and AIDS. So first of all, what is the difference between HIV and AIDS? And does everybody who have one have the other? Well, HIV, or human immunodeficiency virus, is the virus that gets into somebody's body and attacks their immune system. Whereas AIDS, or acquired immunodeficiency syndrome, is a disease that occurs when somebody is infected with HIV for an extended amount of time. Usually it's about 10 years, but it can be less or more depending on the person and their health. And when that goes untreated, they get AIDS. So how does HIV enter somebody's body in the first place? Well, there are 4 doors that this is possible through. So the first door is your vagina. Second door is the tip of your penis. Third door is your anus. Fourth door is an open wound. This open wound is actually how it was first transformed from SIV, or simian immunodeficiency virus, in monkeys to HIV. Because when hunters were hunting chimpanzees, it was a tough fight. There were wounds, there was blood, and and they became infected. But this is also really common in mother-to-child transmission, so through the birth canal. There's a bunch of little micro tears on the babies that it can happen that way, or in an IV if there's an infected blood donor, which doesn't really happen anymore, but back before we knew about HIV and how it can spread, this would happen a lot. So the wound was just putting the needle to the arm. Also drug users that use needles, that can happen that way. Most common though is the tip of the penis door, the anus door, and the vagina door. So what are the fluids that take it from one person to another person's door? So that would be blood, which is how the micro tears of babies during birth get infected through the blood of the vagina of the mother. The next one is vaginal secretions. Third is semen. Fourth is pre-ejaculate, which is different than semen. And then the 5th one is breast milk. Breast milk isn't highly infectious. However, because babies are drinking so much of it, it becomes dangerous to them and it is transmitted. However, most mother-to-child transmissions are through the birth canal. So, how many people have HIV? Is this a disease of the past? Didn't this happen in the 80s? Well, there are still currently worldwide about 33 million people living with HIV. And in the United States alone, it's about 1.2 million people. Globally, there's about 2.7 million people getting it every year, and so the incidence is really high. In the United States, it's about 40,000, but for the U.S., with our highly advanced medical treatments, we know to practice safe sex, we have everything available, the 40,000 a year is still really high. And what the worst part is that 2 million of these 33 million people globally that have HIV are dying every year. So why is it still spreading in the United States anyways? Why is the incidence still going up when we already have the treatments and we know what to do, and we have a general idea of how not to get HIV? Well, 25% of people do not know they're infected, and that leads to 75% of the incidence. A lot of that, people who don't know that they're infected, is because it could be ignorance, it could be people often, because of the stigma of HIV, people don't want to know. People don't want to get tested, and that's true across the world. There's such a high stigma, and it's so unnecessary because it's so common, anybody can get it. It is not subjected to just one group of people, really anyone can get HIV. So the most important thing for your own personal health is to be safe, be faithful, know who your partner's with, and know what their history is, and most importantly, get tested.